Hello.
Hey,
Morning.
hey, now we have, oh wait, let's see, we have three right now. Oh wait, it's just you and me.
Look at you.
And,
You.
Haley, okay.
Oh, it is 9 o'clock there. I guess I was like, you're all done up and everything this early, but it's 9 there.
Yes. Yeah, I actually just threw on a sweater, but,
Oh,
and my
this is
hair
how
was
you
curled
look.
from yesterday, so,
But you look great.
oh, thanks.
Yeah, I had looks like we have four on. Hey guys, I promoted you to panelists. So I want you to join the meeting. So just like go ahead and accept that, and then you could be right here with me and Paige in the room. There you go. All right, excellent. Do you think, Paige, that this is everybody?
No, actually we have
Couple more?
three more that'll come actually.
Okay, we'll give it, it's still only six, well, my time. We have like 4 more minutes before the time, so we'll just give it just a minute.
Okay.
Allie here, so. How's the weather there?
Bad. It's
I
very
know.
dark,
It's what?
very dark and rainy looking.
Yeah, I was looking out your window. That looks like it's a little bit cloudy and stuff.
Yeah. How is it there?
It's getting cold. It's supposed to snow. It always snows on Halloween night.
Yeah.
That way all the kids have to wear coats over their costumes. Allie, I'm going to promote you to panelist, so just accept that, and then you could come on into the meeting. If you don't want to be on camera, you don't have to. There you go. This is for your guys' benefit. It's going to be pretty informal. I do have a PowerPoint that we'll go off of, but really like, let's just talk through it and what do you guys want to know? And, we'll go through the PowerPoint, but really kind of just keep it informal and more chit chat on what you guys need.
Okay.
A couple more minutes here. What are you guys doing right now in school?
Like with classes or well, we have pharmacology, oral pathology, local anesthesia.
Oh, that's heavy.
Yeah, radiology. It's just a review radiology class. And then clinic every Monday, Wednesday.
That's a heavy load.
Mm-hmm.
Pharmacology is hard.
It is.
It's interesting though,
Mm-hmm.
An oral path is tough. But you're almost.
Yeah. What?
I was just going to say you're almost there, but what were you going to say?
For pharmacology, how did you get through that, with studying the generic and brand names?
Gosh, I got to remember, that was back in 2003. So trying to remember how we did that. I remember I did a lot of studying. I think I used cards, flashcards to associate. I'm a kind of a word associate person. And so I think I did that, but I think mostly just, studying with friends. We always had groups. Do you guys do group studies?
Not too much, actually.
No. We did a lot of that, or at least partners. So that helped. I can't really specifically remember exactly how I got through pharmacology. That's a tough one.
Practice.
What's been your hardest class? Chemistry or pharmacology or?
I feel like pharm is probably the toughest. Yeah.
Pretty tough. Learn all about those medications though.
Yeah.
Sarah and Allie, you guys, and Kaylee, whenever you guys have a question and stuff, please feel free to ask or jump on in. I know it looks like you don't want to be on camera, and that's okay. If you want to be on camera, that's great too, because this is pretty informal. But just, feel free to unmute yourselves and chat whenever you want. Do you think that there's going to be more?
There was one more. She said she was coming don't know where she is. It was Sam. I don't know if you remember her from, I don't know if she talked to you one time. She has blonde hair.
Oh, okay. I was just gonna ask if she had brown hair. Okay. Well, I met pretty much everyone in your class, didn't I? They were all
Yeah.
there, right? Yeah, so I think I pretty much talked to everybody that was there.
Oh,
So,
there she is.
there, yep. Okay, let me just. Okay. We'll wait till Sam jumps on and then we'll get started. Okay. Hi, Sam. Okay. Okay, we'll get started, guys. So I was just telling everybody, Sam, that, this is pretty informal. I do have a PowerPoint. We'll go through the PowerPoint, but let's, just deep dive into, each slide, ask away, because this is your time to ask away. And just to let you guys know, I've been of course, I'm a hygienist. And what's this? Oh, sorry, I got some kind of a message from Zoom. I've been a hygienist. I still am a hygienist. I have been a director of sales and training. I've been a division director of hygiene support with Aspen Dental. I've been a manager with Clear Choice Dental Implant Centers. So I've done a lot of interviewing. I've done a lot of hiring, a lot of training in the last decade, 12 years. So this is just my experiences that I've had with interviewing and what I've seen. So I have a couple of fun stories, as we go through here, but that's, I just want to help share or enlighten you with anything that I can. It's a little bit different. We're talking hygiene. Has anybody interviewed yet? No? Okay. I want to know before we get started, what is your biggest concerns or fears about interviewing?
I guess if they ask a question and I don't know something.
Yeah, that was mine too. Like if I just go blank, I don't know how to answer it.
Okay, perfect. Well, I have some questions today for you and some responses for you today. So we'll go through that. So that's good. And that's always a scary one for people because they're always like, I don't know what to say. They just go, and then also some questions that you can ask. So anything else other than that?
I feel like mine is, what's your greatest weakness? Because you don't want to answer something serious.
All right, Allie, that's great because I actually have that on this PowerPoint. How do you answer that question? Anything else? What to wear? Anything? Okay. All right, well, let's get started. Some of those are on this PowerPoint. I'm going to share my screen. Let me just get this started. Hold on a second. Oops. Can you guys see my screen? Okay, yeah. And you don't see my notes and stuff, right? You see the main screen?
Right.
Okay, perfect. Okay. So let's go ahead and get started. This is going to be the objectives for this course here today. We're going to go over quickly on some resume writing, but I'm not going to go into that in huge detail. I have a whole nother presentation on just resume writing, but you do have to have that good resume to get your foot in the door. How do you prepare for your interview? How are you going to present at your interview? Review interview questions and answers and things never to say during an interview. And then how do you close an interview? Here is a website you guys can snap, take a picture, write this down, whatever. But, I know we're in hygiene, so it's not super duper important to have a cover letter when you're applying for hygiene, but it does kind of set you apart. It shows that you've went that extra step, so write this down if you guys want to make yourself a cover letter. There's lots of different websites that you guys can use for these kind of things. I know I've used them all. So let's talk a little bit about what makes a good resume. For one, choose a resume that reminds you of you, but you're going to want to use a good template. I've had resumes come to me and they're just, just a bunch of words on a page. So find a nice format that you want to use that reminds you of you. Make sure that you have all the relevant information, right? Like, what are your skills? What are you, what's your, or the dates that you've graduated? Just everything needs to be correct. Make sure that you proofread it too, because I've had resumes come to me where there's misspelled words and, the dates are incomplete or the dates don't line up. We actually look at those things. So make sure that you proofread it and, that it's all correct information. Stick to the truth. If you've been fired from a job or let go, eventually it comes out. So always want to just, keep to the truth. And I'll show you how to answer that question too, if you have been let go from a job, or maybe you've left a job because of, a negative situation. So we'll go through that. And then make sure your resume is aesthetically pleasing. There's nothing worse than me getting a resume and it's like all kinds of different fonts and, or bold, and it's just too much for me to read. And honestly, I'll just put that one aside and look at the ones that are more aesthetically and easier for me to read, right? They're not mumbo jumbo to me. So just some tips on that, 1-inch margins, use professional fonts, don't get too creative. They might be pretty for you, but maybe not for somebody else, right? Font size, use 14 to 16. Use bold sparingly. Like I said, not too much going on the page. You want to, don't make it real loud, I guess is my point. And then keep your resume, this is hygiene. We're not applying for directorship or, any other CEO position. So keep it to one page. You can always just write down references upon request, so you don't have to put your references anymore. We used to like that, but now it's like, if we want to ask you for your references, we can ask you for that. So any questions on the resumes? Here's some websites. I've actually used some of these. I personally have had actual companies write my resumes for me when I was applying for, higher level positions. Paid them like $125 to do it, but it, got my foot in the door. So don't be afraid to do that either. It's just some real quick resume do's and don'ts. I'm not going to go through all these, but some of the main things is you don't want to like send your resume out to 50 people. It's just bad etiquette, and rejection gets hard sometimes too. I know right now it's a great market for us hygienists, so that's awesome. Make sure you know what the job description is. Of course, we know what our job description is because, this is hygiene, but you'll never know. Sometimes, I've ran into positions where they want me to do something more as a hygienist in that particular office. So, know what that job description is, read it over, and then tailor your resume to that. Not that it applies to you now, because I know you're just going to be, looking for a job as your first hygiene position, but maybe, who knows, you don't like hygiene and you want to move on to a sales position or whatever. So you'll always want to know what that job description is and then tailor your resume to that. So you're talking about hygiene, but you're applying for a sales position and they're like, this doesn't relate. It's not relevant. So make your information relevant to the job description. This is for future information too, not just for your first job here. And then, do it in chronological order. We already talked about one page. We talked about weird fonts. So, and then we talked about that whole massive information that like, it's scary to read. So make it, make it nice, put it in paragraphs. Okay. Any questions on resumes before we get going on the interview? Anybody having trouble writing their resume? Have you guys started yet? Okay. All right. Okay, so I want to just jump in now that we've actually got our foot in the door because we had that good resume. Preparing for your interview. I like this quote because if you fail to prepare, you prepare to fail. That's what I believe. So you're always going to want to do your research. Okay, so go to that doctor's website, or if you're, joining a DSO, go to that company's website, know about that company or that doctor, what's its culture. I know that the employer will appreciate that when you bring that up in the interview. When I applied for this position on the academic team, I knew who was going to be interviewing me because I knew his name. So I went on LinkedIn. I found out that he was has a doctor, a PhD in education. So I brought that up during our interview. He liked that I had done my research. I knew about the company. I had worked for them before anyway, but still, I knew what the new initiatives were. So just do your research. Know a good response, right? We just talked about that. That's some of your guys' concern for frequently asked interview questions. Don't want to get caught not, just staring into space, not knowing what to say. And then you need to have some good questions prepared for the interview. Remember, guys, you're interviewing them just as well. Okay. So they're just not interviewing you, you're interviewing them. Are you a good fit?
I have a question with that.
Okay.
Is it rude to ask like how much you would be making on the job?
Great question. That is later on in my PowerPoint. And yes, it is rude. Because, well, at least that's how people take it as rude, because they're wanting to know. And, Sam, I wish more people would just ask that, ask me that, because I hear a lot of employers say that's one of the first questions they ask. It's like you're not interested in, the company, the position. You're just more wanting to know about the money. Maybe even in the back of our heads, we are just interested in the money. I don't know. I don't know what everybody's like, but, I know when I got out of hygiene school, I was already 36 years old. I wanted to make some money. I was interested in that. I also wanted to move up in a company. I was very, very interested in patient care. Don't get me wrong. That was the first thing, my first priority. But, I did want to ask those questions sometimes, but I probably did ask that before in my life, and so, yeah, so we'll get to that. We'll talk about how to handle that, but that's a great question. I know that, like, I did some mock interviews with some students from a college in Wyoming. And when I said to them, hey, what questions do you have for me? And they're like, don't really have any, and so after the mock interview, I talked to them about that, have some questions prepared. Because to me, it looks like, you're not really engaged. You don't, if you have a lot of questions to ask, or at least three good questions, it makes you look like, you're smart, you've done your investigation, so just have those good questions. And I have some for you at the end of this PowerPoint, where I have a whole list that you guys can write them down, and we could talk through them and see what ones you think are good and which ones you don't. You can ask things like, what's your office flow look like? When I finished with those mock interviews, I said, you're not curious about, like, what does the flow look like? You're not curious to know if I'm going to make you do prophies on SRPs. Like, don't you have any questions like that? So those are things I want you guys to think through. Or are you flexible on my appointment times? Just things like that. Have a professional outfit ready. So it's hard, I know, because you guys are living in scrubs right now. And I remember going to my first interview after hygiene school, and I lived in scrubs. I didn't have any really dress clothes. So that don't go into your closet that morning thinking that magical outfit's going to appear, and have something ready, some nice slacks and a blouse. I don't think, we as hygienists need to go in a business suit, that's more high level. So dress for the job that you're looking for, that you're applying for. If you one day are going into that job that you're applying to be a manager, or, or moving up in a company, then, that's when you want to start wearing suits and things like that. But, let's talk about scrubs a little bit. Do you guys think that you should wear scrubs to an interview right now?
No.
Okay. I think that that's correct. And I think, the only time you would do that is if you're going to do a shadow. If you're going to shadow an office, that would be okay to wear scrubs. But maybe just ask them, would you like me to wear scrubs to the interview since you're doing the shadow? Because maybe you're not going to be doing anything. So just, dress to impress.
I have a question.
Okay.
Do you think it's always like necessary to do a shadow, or like when do you think that's a good idea?
I think it's always a great idea. And that's a good question. You know, I probably every clinical job I had, I temped. And I went and temped for an office because I want to see what that office looks like. You know, I don't want to just, you know, hope I like that doctor. You know, maybe they're nice in the interview, but then you get there and they're, you know, they're kind of a jerk, you know, or maybe the office manager is a jerk. And I'm just being real, I'm being transparent, probably not saying very professional things right now, but it's true. You know, I've been in offices where I was there for like 2 weeks and I was just like, oh gosh, you know, I can't get along with this office manager, or, you know, it happens all over. So I think it's a great idea to go and shadow an office, you know, like that way you can see, you know, what their true colors are. Maybe shadow a couple times even. And then we're going to ask all those questions because those kind of questions are really important. So you get to know, what is this team like? What is this culture like in this office? Okay, so anyway, if you don't have a professional outfit, go to the thrift store, borrow an outfit. Have the correct information for that company. I've had people show up to my office to interview with me. They had the old address to another building. They were 15 minutes late. I mean, it wasn't their fault, but like maybe it was, right? Because they didn't do their investigation. They didn't make sure that we had moved like 3 months earlier. And they didn't have my phone number or the company's phone number. I didn't have my phone on me, so they couldn't call. So just be prepared, you know, and I know most hygienists are, because we're pretty much all type A. So we usually have all this info, but believe me, I've ran into people who don't. So just some nice little tips here. And then have a tangible resume. I know that people send me their resumes via email or, you know, whatnot, and it's great. I have them, but guess what? All of a sudden I don't have them when it's time to interview you. So it's always nice. And you look prepared, you know, you hand that resume to them, you look prepared. Show up 10-15 minutes early is nice. I had a friend who applied as an adjunct instructor at a college, really wanted that job, was totally prepared, but showed up 5 minutes late. And they were like, sorry, we'll still interview you, but out of courtesy, but you know, you won't be getting this position. They told her that, and she went ahead and interviewed, even though she knew she wasn't getting the job because she was 5 minutes late. So 10 minutes early is nice. Don't be too early. I know I've had people like, I can see them from my office and they're like 30 minutes early. And I'm just like, oh my gosh, that now all of a sudden I'm under pressure as a hiring manager, you know, and, or the office manager or the secretary who's at the front desk, you know, are staring at each other, you know, for 30 minutes. So that gets kind of awkward. So I think 10-15 minutes is a great time to show up, but it looks like you're, you know, I love when people show up a few minutes early. It always makes me go, they showed up early. And then I don't mean that you just have to focus just on them, but remember to focus on them. So it's not just about you and what your needs are, but like, what are they looking for? What do they want from you? You know, so make sure that you're, you know, asking the right questions about the company as well. And then the tip of the day is never, never, never discuss religion, politics during an interview. And sometimes I've actually had doctors say the craziest things when I've interviewed with them, or in my career, other people who've interviewed me, non-dental people, and they start saying things like that. And they try to get me engaged in that. And I just do not engage, you know, because they'll hold it against you as soon as you walk out the door. Even if it's like sports, you know, you say something about sports. Oh, I don't like that team. Well, guess what? You're probably not going to get the job because you don't like that team. So those are things to stay away from, those entire conversations. Okay, so that's how you're going to prepare for your interview. So let's talk a little bit about what to wear. And I know that, you know, you guys probably have this down pretty well, but I just kind of want to tell you a few stories that I've had happen to me. So we talked about you're wanting to dress for the job that you were applying for. I had a gal come to me. I was hiring for consultants on dental implants to talk to patients about dental implants, get them out of their dentures. She came in with a super short skirt and a low cut shirt where, you know, her cleavage was hanging out. And it was distracting, so don't dress scantily. I know like, hey, if we want to go out in the evening and dress like that, that's fine. But when you're at an interview, dress appropriately. Wear nice shoes. That seems like a simple one, right? But I've had a gal come to an interview with me in jeans and fringe boots. And it just looks to me like, you know what, you didn't care enough to dress up. So, just wear some nice shoes. Don't wear, thong, even if they're cute little slip-on thong shoes or sandals, whatever, just, wear nice shoes, especially when you're going into a dental office, because we're not supposed to be wearing open toe shoes there anyway. Right. So, and then, nose rings. I had some girls come and interview with, hoops in their noses. And this is a very subjective conversation because lots of people feel like, you know what, I can wear what I want this day and age. And, maybe you can, but maybe you can't. So maybe that doctor doesn't want you wearing that kind of stuff. So that can always be a question too. You don't have it on, but maybe I do wear a nose ring. It's a small, would that be okay? Just find those things out. If that's something you feel really strongly about wearing, then those are kind of questions you want to ask. And then of course, like I said, this is not, going out Saturday night. So wear your daytime makeup. And we talked about scrubs already. Let's go ahead and talk a little bit about first impressions. So you're sitting out in the waiting room and, maybe you just had even a bad morning, but try to make sure that you're smiling, you're not chewing gum, you have good body language. So when the hiring manager comes out to get you, right, you're smiling, you have good body language. I know this kind of sounds like really good body language, but that's so important during your interview. When you walk up to that hiring manager, you're not, running up to him, or I've seen people literally walk up to me so slow, like, getting their purse or whatever, and just, it's almost like they're tired and they're lazy. And I'm wondering to myself, is this person going to be like this throughout the day, throughout the job? So, just have a good gait. Handshakes are kind of controversial right now with COVID, but if, right now I think, people are starting to touch, handshake more now, but if you don't feel comfortable, that's fine. But if someone reaches out and you feel comfortable shaking their hands, do so. Studies show that this might be your only moment of physical contact with that person, and it plays a significant role in your first impression. That's what everybody says. That's what the studies show. So who knows what coiffure means? It's an old word. No one ever knows it, so I'm going to take it off of here. But I like to laugh about it. It means your hairdo. What's your coiffure? What's your hair look like? So you don't want to show up in a ponytail. You don't want to show up in a messy bun or a hat. Messy buns are really cute and ponytails are cute, but you want to just look put together. So do your hair. And then I have a question for you all. Who thinks that you should have a cell phone with you during an interview or turned on?
I think with you, but not turned on, like out of sight in your purse.
Great, excellent. What do you think about just turning it to vibrate?
No, because you can still hear the vibration.
Yes, that is very, very, very true. Especially like, you're sitting out in the waiting room, you've been waiting for 10 minutes, whatever, or 5 minutes goes by and you get a call and, you go, oh, I have, my interview is not for 5 more minutes. So you pick up that phone, you start talking, or you're texting, and all of a sudden that hiring manager comes out and, or the doctor, whoever it is, and they're like, Paige, are you ready? And you're like on the phone all of a sudden, and you're like, oh yeah, hold on 1 minute. Okay, I gotta go, and then the hiring manager was like, waiting, or you're texting. And then exactly when you're on vibrate. So I've been in conversations with people, deep conversations, like, tell me your weakness, tell me your strength, whatever, we're going through that. And then all of a sudden I hear their phone buzzing in their purse. And then they're like, excuse me, let me just shut my phone off. I'm sorry. But like that moment's lost. You can't get that moment back because now you just shut off your phone. So exactly, turn your phone off, just, it's only, you know, an hour-long interview. We can live without our phones, I think, for an hour or so. Okay, any questions on any of that? Another thing I always think about when people bring in their phones and they're on their phone, I always think like, are you going to always be on your phone during the day while you're working with patients, you know, every chance you get? So what do you guys think these numbers mean? Anybody have any clue? I'll tell you what they mean. This is what they mean. This is how important. I was talking to you earlier about your body posture. It's literally studies, many studies have been done, and I agree with them because I can tell if I'm going to hire a person in 5 minutes. 55% is your posture, your body language. 38% is your voice and tone. You know, like I already told you about your posture. Are you slumped over? Do you look like you're lazy? Which, you know, your voice and tone is super important. What if you're talking really low like this? And well, my name is Paige and I'm really, you know, like what? I can't hear you. And then you're thinking, are the patients going to be able to hear you? You know, so make sure that you're talking loud enough and clearly enough when you're interviewing, because I know I'm thinking you're going to be talking to patients. Are they going to understand what you're saying, especially if you're really mumble jumbling, you know? So and it's hard, I know, because you're nervous at an interview, but just, you know, try to speak up if you're a quiet, you know, person. And it's okay if you are, that's fine if you are, but just, you know, when you're interviewing, want to, you know, bring up your voice a little bit and your tone. Don't be real monotone, everything sounds just exactly the same, right? Have some spirit, you know, stand out. Also, like maybe you're talking too loud. I've had those too. It's like, whoa, you know, and the patients are going to feel that way too. Somebody's really excited. Oh my God, they're talking so fast. And oh, you know, and it's like, whoa, you know, that's going to immediately tell me, gosh, I'm going to have to listen to that every day, all day long. So are the patients. So, you know, try to think about your tone, your voice, keep a good pace, you know, don't talk too fast, don't talk too slow. And then can you guys believe that only 7% is content only? That's what matters, is 7%. So content is important, don't get me wrong. But when I see you and you're confident and you're standing up and you're talking clearly and you seem confident to me, you know, you're the person that I want to hire. Any questions on that? Have you guys ever had know anybody that, you know, has anyone ever interviewed anybody before? No? You might one day, you'll see what I mean. Okay. Eyes are the window to our souls. I see eyes as honesty, confidence, trust, all those things. It's difficult to trust somebody when their eyes are like, you know, averting away, or they're not paying attention to me, looking around, you know, when I'm talking with them. I used to be married to a guy who could not look any person in the eye. He was such an introvert, real good looking guy, but he just could not look anybody in the eye. And people used to ask me, how come he can't? I'm like, that's just, you know, how he is. But like when you're not looking somebody in the eye, it shows a lack of self-confidence, self-esteem. You know, like, what are they thinking? Why are they looking around the room? Am I not interesting enough to you during this interview? So do you guys know anybody like that? Or have you ever encountered anyone who can't look at you? No. Don't stare them down either though, right? So be too confident, you know. I always tell everybody, try mirroring the person that's interviewing you. You know, just if they're you know, laughing, you're, you know, just mirror them. You can laugh with them. You know, if they are standing, then you can stand, you know, like just mirror the person that's interviewing you. That's a really, really good habit to get into, is mirroring people. They smile at you, you smile back at them, right? Any questions on eye contact? You guys think eye contact is important? It's really, really, really important. Okay. So this is just a fun slide to go through what everybody is saying. We'll go through some quick do's and then some fun don'ts. So we kind of talked about this already, just sitting with confidence, arms at your side or on your lap, look comfortable, look relaxed, look confident. I know it's hard because you're going to be nervous, but you know what? Like I said, always remember you are interviewing them as well. Okay. You're going to be prepared. So you're going to be more confident now. You can even lean forward a little slightly to show your engagement. If you're hanging back, it doesn't look like you're that engaged. So let's go through some fun don'ts. Fidgeting. I love when people interview and they're playing with their hair or they're flipping their hair constantly. I could tell they're nervous. Spinning, rocking in your chair. I was interviewing this guy one time and he was leaning back in his chair and poof, fell right back, right in front of me. Couldn't believe it. So I know that sounds like a silly one, but try sit still. You never know when you're going to fall down. Tap or click your pen. If you have a pen in front of you, you're nervous. So you're doing all these nervous things. Look confident. I have this doctor who interviews and he's always tapping and clicking his pen and it drives me crazy. I always tell him stop doing that. Same thing, swinging your feet, your legs, try sitting stair. Don't slump in your chair. That really looks like you're not engaged. So like I said, you could lean forward. You don't want to, be like, this though, or, so these might sound like easy things to do, but you'll find yourself when you're interviewing, you might start doing some of them because you're nervous. Don't stand, even if your legs hurt or you're tired or whatever. You had to do a long drive for your interview. If they're standing, it's okay. But like I said, just mirror them. But I've had people say to me, oh, that's okay, I'll just stand. And then I have to stand now because I can't interview you while you're standing. What do you guys think about crossing your arms and legs? What does that mean to you when you see people who have their arms crossed? Anybody have any ideas what that might look like?
Typically, that means the person is more closed off and it's more of a defense mechanism.
Exactly. Ma'am, you're either defensive, right? Or you're insecure. I mean, maybe you don't like something they're saying. And you closed off is a huge one for me. Like it means like you're not really listening to me. This is how important body language is. That's why I say, just keep your hands at your side. So don't cross your arms, crossing your legs. I know that's an interesting one, right? Like, why can't I cross my legs? Or, well, for instance, my legs go numb when I have them crossed for too long. What if you're sitting there? What if they really like you and they're interviewing you for more than 30 minutes and all of a sudden you're, moving back and forth because your legs are going numb or so it looks like you're fidgeting. So just be careful. It's not that you can't cross your legs, but just be careful that you're not fidgeting, I guess is my point. Okay, let's get into some questions. Here's what you guys asked about earlier. So let's talk about some questions. So tell me about yourself. Tell me about yourself. You're going to hear this all the time. What do you guys think they mean when they ask you, tell me about yourself? Do you think that they want to hear about your personal life? Oh, well, let's see, I'm 30 or however old you are, 25, 24. I love to ski. I'm from Colorado. I'm married. They don't want to hear that. They're actually wanting you to tell them about yourself, your professional self, your qualifications, your work experience, and why you're a good fit for the role. Okay. So you're not telling them anything personal. So tell them a story, but it's got to be like a professional work story. Make it engaging, make it compelling, and be concise and clear. Okay. So let's just take a look at the tips over here on the left side. So you're going to want to give a snapshot of your work history. Okay. So, so now you guys, you're in school. So you'll mention your school, you're a student, you're a dental hygiene student, right? How many years you've been there and what your responsibilities have been there. So, let's talk about that over here on the right. So, and I just kind of made some stuff up. You guys can put this to your own, and we can talk through this right now too. So please feel free to just throw out some ideas. I'm a dental hygiene student. I just graduated from University of Indiana. I ended up graduating with 3.5 or 4.0, whatever it is. Tell them what you learned there. If you're a SADA president, it's a great one to say. So any kind of accomplishments that you have, right? So that's your snapshot. You've just told them, you know, how long I've been going for 2 years. This is what, or 4 years, or however long your program is. Any duties that you've had at that job, or they're going to ask you about prior jobs too. Maybe where did some of you guys work at before you went to dental hygiene school?
I was a lifeguard.
Lifeguard. Okay. So you can definitely talk about that, what your duties were there, how long you were there, what company you worked for, you know, because they might ask. I might say something like, really, what was that like? Tell me about that. Because that's a fun one to talk about. So put it in a snapshot, right? And then let's talk about number 2, your accomplishments. So accomplishments are something that are quantitative. It's a measurement, right? Not just something you've done, but what did that accomplishment, what was the results of that accomplishment, right? So let's look at number 2 here. Let's talk about something that one of you guys are proud of, one of your accomplishments at school. Tell me something that one of you guys have done that you've accomplished. Anybody got any philanthropic programs set up? Anything for the school? Maybe not. Okay. Well, think of something that you have in your past, you know, something that you have accomplished, something that you're proud of. You know, like for myself, I'll just give you an example for me, and I wrote it down here. When I was in dental hygiene school, we had to find our own patients. So that was really difficult. So I went ahead and went to the Salvation Army, and I set something up with that, with the Salvation Army, with that director. And they literally bused patients to our school for our perio patients. It was huge for all of us because we couldn't find patients, believe it or not. So that was something, you know, that I was proud of, that I got started. It helped every one of us students. It also was a win-win for the Salvation Army. We ended up partnering with them. It helped save money for everybody. So those are the kind of things that I would say of an accomplishment that I have. So think of an accomplishment that you have. You got to find one, because someone's going to ask you, I guarantee you. So what's your biggest accomplishment in your life? So think of something that you've done. It could be big or small, but just be specific about it. And then tell the employer that, so we're on tip number 3 here, what you know about the role. So of course we're applying to be a dental hygienist, right? So we know about the role, but maybe you could say you've already done your investigation and you've already been listening to your interviewee. So maybe you heard them talking about a lot about a perio program. So you can say, it sounds to me like you're really looking for someone to start your perio program, right? You're looking for someone who can really educate your patients, and maybe they're looking for a higher production. I don't know, just depends. I'm just giving an example, but know that you let them know that you know what that role is about. Because I had a doctor that wanted me to do the new patient exams. He didn't have a perio program ever. His dad had been the owner of that practice and for 30 some years, and he was retiring. So he was coming out of school, and everybody that I saw had calculus on their x-rays. They never had an FMX. They'd never been probed except spot probing. So like he was looking for someone to start him a perio program. So just know what that role is. Okay, and then number 4, why are you the best candidate for this role? What do you guys think about that one? So tell me, Sam, why do you think I should hire you? Why are you the best hygienist for this role?
I don't know. See, that's what I was talking about. I don't know how to answer questions like that and be put on the spot.
Right. So that's why you guys have to prepare. So, and here in the next couple slides, I'm going to have some answers and some questions, but make sure you write these things down and know them like the back of your hand when you go into an interview. Because if I were to ask you that and you were to go, I don't know, like not a good enough answer for me, right? What now? Tell me truly, Sam. Tell me truly, why do you think you're the best hygienist for a doctor's office?
I honestly don't know.
What are you good at?
Cleaning teeth,
Okay. Are you good about talking to patients?
yes, and building relationships with my patients.
Well, looky there. You just found some things that make you a good fit for the role. Okay. So if this doctor's looking for a perio program, you might say, you know what? I'm super passionate about perio. I saw a lot of perio patients. I'm really good at educating them and getting them to accept treatment. I'm so good at building rapport with them. They trust me right away. Like those, I know it's kind of like when someone asks you that question, like what in the world do I say? But you have a lot to say, because if you are good at building rapport with patients, that's great. Because I've met hygienists that are not. They go in. I went yesterday and had my teeth cleaned, and I had a hygienist just start coming at me with a probe, and she didn't know I was a hygienist, because I went to an old doctor I used to work for, and I was like, what are you doing? She didn't even tell me what she was doing with the probe, even though I knew. But so if you're good at that, tell them, here's why I'm the best fit for the role. Passionate, build great rapport. So those are the things. Write them down. Sit down and write down things that you think you're good at. All right, let's move on. Any questions or comments on that from anybody? Okay. Here's that question someone said earlier. What are your weaknesses? So think about this when you're talking about your weaknesses. The first thing you want to think about is, what weakness do you want to say? I'm an impatient person. And if that's what you want to say, that's fine. But remember, any weakness that you say, you have to turn it into a positive. And I have a little cheat sheet for you on the next slide here, but a weakness, you don't want it to be your personality trait, because then they're going to be like, oh, so she's always impatient. If you just say, well, I'm impatient, or I'm introverted, or whatever. It's not one of your strengths in disguise. It's a concern. And you have to show them that you're improving upon that concern. Okay, that's huge. So I want you guys right now, well, not right now, but right after this, write down a weakness that you used to have and a weakness that you have now. And I want you to be able to elaborate on those weaknesses. So when you get asked that question, you're going to be ready. So let's just say if I did say, well, let's say I'm an impatient person because, I'm a go-getter, I'm a shaker and a mover. And, the doc gives us tasks around the office, keep the office clean. And I get my tasks done. And then I'm like, well, how come everybody else is sitting around? Like, did they get their tasks done? I'm that type of person, right? Because I want everybody to be fair and square, right? So then I'm like bugging my coworkers saying, well, did you guys, did you fold the towels or whatever, because believe it or not, I had to fold towels before in offices. So yes, so I would say, well, I tend to be impatient sometimes because I'm a shaker and a mover and I want to get things done. And when my coworkers aren't, I've appeared to be impatient asking them what they've gotten done. Okay, so maybe I've said that, but I want to, in the end, say what I've done to improve upon myself, right? So you know what, I know that about myself. I've learned to be cognizant of it. So what I did to help myself is I started having a meeting at my last job. All of us had a meeting. We talked about our tasks, what we've got accomplished. And it helped me to not be impatient anymore. And actually, it turned out that the office really benefited from it, and it became more efficient from all of us just having that meeting on what we were doing. And I'm no longer appearing to be impatient. So let's say, is anybody introverted here? Let's just use that as a weakness. Okay, so maybe you're an introvert, or you're quiet, shy, introverted. So you can use that in the same kind of example. Or maybe you're too detail oriented. Does anybody feel like that's one of their weaknesses? Like they take too much time because they're so detail oriented. So you can say those as weaknesses, but then just say how you're working upon them and how you're improving them. That's really what they want to hear. Don't leave that question open to that you're in the negative with, yeah, I'm just way too detail oriented. I am detail oriented, but here's what I've been doing to work on it. I've stopped doing this, I've started doing that, and here's the result of it. Does that make sense to everybody? Anything else on weaknesses? Anything that I can, did that kind of answer some of your questions about that weakness question, or is it still like you're still not understanding how to answer that question? We're good on it? So here's a little cheat sheet for you guys, so you guys could take a quick picture of it if you want. So if you don't know what your weakness is and you don't know what to say, like what I just did, this little cheat sheet, fill in the blanks. So in situations where there are a lot of people in the room, I've tended to leave the room because I don't feel comfortable with that many people. This made me appear to be introverted. As a result, I learned to understand that about myself. Now I make sure that when there's lots of people, I go into the room, I make sure that I ask them questions, I'm engaging. And now I'm much more engaging as a person. I've learned a lot about people. It's really helped me become extroverted, right? So those little bullet points are just little things that you can write down, fill in the blanks with what your weakness is. I want to hear just from a couple of you, what do you think your weaknesses are?
Well, I'm a perfectionist. I feel like a lot of us probably are.
Okay,
But
so that's a great one. So write down perfection in there. Think about where that slows you up. Think about where, and being a perfectionist can also be a strength too, right? So that's something you can say too, like, well, it's a weakness and a strength for me. Where it's a weakness for me is because it might take me longer, during the day. So I've learned to cut back a little bit on, my perfectionism so that I can, so maybe I have to do a prophy in an hour, and I've realized that I can't be such a perfectionist or overly perfectionist, at this, and that. So I'm able to be more timely with my patient, like, do you kind of understand what I'm saying? Does it make sense, or am I not making sense?
no, yeah, that makes sense.
Okay. Okay. All right. So what are your strengths? This is also a tough question too, right? It's important though that you identify your strengths. It's hard to talk, good about yourself sometimes, right? Like, oh, I don't know. So brainstorm your strengths. Okay. Maybe it's your experiences. I'm experienced with a particular task or your expertise at something. Maybe you're an expertise with oral Bs, or Sonicare, or maybe you're expert in perio. Maybe you're great with products, selling products. I used to love selling products because, like, I think everyone should have an electric toothbrush. So, think about that. Maybe that's, something that I'm experienced with. Your talents, this is endless. Your talents can be endless. Maybe your attention to detail, your listening skills are fabulous. You really listen to those patients when they talk to you, so you understand why they're not brushing or flossing. Like, think about those things. Organizing events, I'm really good at that. You find one of your talents. Your soft skills, you're a good listener, those kind of things. Maybe you have some relevant background in education, degrees. So find that, brainstorm what one of your strengths could be, get 4 or 5 written down and then know how to talk to those. Okay. And then, you're going to want to go ahead and just narrow it down to 3, 4, or 5, and then know what you're talking about there. Let's look at the, here, hold on. Move this here. Like I said, be prepared with your examples. So have one example. So if you have a talent, Kaylee, you have a talent that you have, and your talent is building rapport with patients. Have an example of what that looks like. Tell them about one of the patients that you've had that you were able to build that rapport, build that trust, have a little story behind it. That's what the hiring manager wants to hear, is more of a story about your strength, just not, vague, like, well, I'm really good with people. Oh, okay, well, I hope you are. So tell a story, because once I hear a story, I'm like, oh, that's awesome. Okay, so always have a story behind your strength. And then over here on these tips, we kind of already went through them, but just be accurate. Choose a strength that you possess, not one that your best friend possesses or one that you'd like to have, because you're going to have to talk to it, and you're going to have to be authentic, because they're going to believe you more when you're authentic. Make sure it's relevant to the job description, and don't be humble about it. Be confident. It's okay to be good at something, and it's okay to say it. You don't want to come off cocky, of course, but it's okay to say, I'm really good at this, and here's why. Let me tell you about a story, what happened to me. Any questions on strengths? You guys going to go write your strengths down and your weaknesses down? This is when I always ask, and this is when I was even asked during the interview for this position I have, is, so where do you see yourself in 5 years? Sometimes I always think this is a cheesy question, but it really tells me what people are looking for. Are they going to, want to be in this position right now? So I think you guys need to understand why they're even asking this question first, right? One of the reasons is that they want to make sure that you're going to be there in the long term. So if you're planning on moving, or, you and your husband or your partner or whatever are thinking of opening a business in a year, you probably don't want to mention those things, right, during an interview. It's a red flag for them. So I always just say stuff like, you know what, I want to learn your office flow. I want to learn all of your equipment. I want to become experts at it. I haven't used that laser before. I haven't used that X-ray machine. I want to, so you're talking about how you want to be dedicated to that position. And then I don't know, once I learn all of this, the flow, and, maybe I can, if there's, like, let's say you were with Aspen, for instance, maybe you want to be a hygiene manager in 5 years. Maybe in 5 years after I've learned everything, I want to get onto the hygiene support team, so just some examples. One of the other reasons is they want to weed out the people who want that job and not get their foot in the door for the next position. They might not even have another position for you right now. So just make sure that you're saying things like, you want to learn everything about their office and become, an expert at, what you're learning now. Any questions on that? My mouse is just not wanting to move. Okay, so no questions on where do you see yourself in 5 years? Where do you guys see yourself in 5 years? Clinical? Maybe, yeah. I thought I was going to be a hygienist for 30 years. My arm gave out on me, but I'm just saying, you just never know. So this could be a question that you might one day have to answer. Here's a good one. Why did you leave your last job? Has anybody been fired from a job? No, I haven't either, actually. But I've been talked to about people who have, when I've been interviewing them, and they start telling me stories about, oh my gosh, the last company I worked for, and then they start saying all these negative things about the company. And I'm just like, I don't want to hear that during an interview at all. Who knows, maybe they're going to say that about our company when they leave. So you have to answer this tactfully. you guys probably, it sounds like none of you have been let go of a job or anything, so you probably don't have to worry about this question, so I won't go into it too much. But if you ever do get let go, or maybe let's say you go find a hygiene job here in the near future, right? And you're there for a couple months and you don't like it. Maybe the doctor is a jerk, or the office manager, or you don't like the flow, or they don't have the same beliefs. Maybe a doctor's trying to make you do prophies on perio, so you leave. What are you going to say at the next job? Why did you leave that job, Allie? Are you going to say, well, the doctor is making me, I'm not doing, it's my license, you don't want to, you don't want to say it like that. So you would just say, me and the doctor had different beliefs, on treatment planning, so just kind of keep it positive. That's okay. I just want to stay positive there, and don't overload with too many details on it either. All of a sudden you're getting yourself spun in a circle. Keep this high level, answer with a one sentence answer, and that's it, and then move on. But always turn it back to why you are why you're the best fit for that job. So even after you say these things, but you know what, I really feel like I'm a good fit here because I'm really great with perio patients. I'm passionate about, the disease process and, helping them get rid of that infection, bring it back so that you're being positive. Any questions on that? Don't waste too much time on that question in an interview. So we already kind of talked about this a little bit. Why are you the best person for the job? Find why you think you are. I was in an office not too long ago, and the hygienist was super excited about, she had come from public health and was super excited about being in one of our offices because we're pretty thorough about our care, right? So she was really excited about the way we do things at Aspen and the proper care that we give. So she was really super excited about that. And, she had mentioned during her interview that she was, really mentioning that to the doctor that was interviewing her. And she was telling him how she thought she was going to be, a great fit for the job because this is what she's been needing and wanting and wasn't getting it in the public health arena. So just, know some of these. Why are you going to be the best person for the job? Make sure that you're listening to what they need and their wants are, and then you're elaborating on why you can do that for them. Okay. We've kind of already talked about this stuff. Don't say anything negative. Don't be too desperate. Make sure you have questions lined up. We're going to go over that next. Make sure you've done your research, a little bit about the company you're applying for, the doctor that you're applying for. Okay. All right. So I want to know what your motivating factors are. Anybody have any idea what they're looking for when they go find a job? What's most important to you?
I feel like I always want to feel like that office is my fit and not just work for the money. So I'd rather go to an office that pays me less, but I feel comfortable there, and I feel like I can my beliefs line up with the company's beliefs.
Okay, excellent. So one of your motivating factors is patient care, right? So you always want to, make sure that you're going to question about that. Don't be embarrassed to ask that question, Allie, instead of, saying about the money thing. I mean, I understand what you're saying, but you might want to say it just like that in an interview, but maybe, hey, listen, I'm really, one of my, passions are patient care. What kind of care, or how do you feel about what kind of collaboration with your hygienist do you give when it comes to perio and prophies? Or whatever, Ellie, your patient care concerns are. Those are your motivating factors. So I think on this slide here, I just want you guys to know what does motivate you, and know those and be ready to talk to those. Okay, what are you looking for from your employer? Okay, and do they match? Just like Allie said, does that doctor's match mine? Are we a good fit for each other? So know your motivating factors. Are you going to make me do a prophy on an SRP? Because let me tell you, I've been in lots of different practices, and like that one where the doctor's son was coming out as a private practice, and he was trying to make me do prophies on all those people who I was seeing calculus on the x-rays. They never had perio charts. They never were perio charted, and they were spot probed. And that, I wish I would have known that about that guy before I went and worked for him, because now it's a conversation where I don't want to do that. So, know what your motivating factors are. So let's, the ethical clinical decisions we just talked about, maybe some mentorship. Is anybody interested in being mentored? Are you just going to get thrown into the fire? Who's going to train me? Right? I just was thrown into the fire when I went out my very first job. And all of a sudden I was doing everything. I had no idea I had an idea what I was doing, but you know what I mean? Like, so if these things are important to you, ask them. What does your mentorship program look like? Are you going to mentor me, doc? Who's going to train me? Like, I don't know your office flow, especially if you get into a bigger office. What about your team members? That's important to a lot of people. I do a lot of surveys with hygiene students, and I ask them, what's the most important thing to you when you find a job? And a lot of them put this on: good team members. They want good culture, right? So know what's going to motivate you, and then you're going to talk about these things. Okay, growth and development. How are you going to grow me or at all? Or am I just going to be, a grunt worker in your office? Are you going to send me to any courses, to learn anything? Do you guys get laser do you get certified laser in your school? No. Colorado, all the students have certification on lasers. So that might be something you might want to ask. Hey, listen, I really want to learn about lasers. Is there any chance you'll ever be able to provide that for me? One of my doctors took me to a Botox weekend seminar because we were going to start doing Botox in his office. So that was it's always a motivating factor for me, growth and development. I always wanted that. Continuing ed, are you going to pay for my CEs or do I have to? Are we going to split them? Have you guys thought about asking any of these questions? Okay.
I feel like I definitely have about the mentoring. I just I'm really worried as being obviously they know this would be my first job, but I'm just worried about being thrown into the mix.
I know it. I really was too. And, at Aspen, we have our mentorship program, and the hygienists get trained for 2 weeks. And then we have our hygiene support team come out and work with them for about 3 days. And, just like on verbiage, what do I say to this patient? How do I talk about the disease process? Because you're nervous. You're like, do I even know what I'm saying? You do, but you're nervous. Or, am I probing right? Or how do I use this equipment? So I agree with you, Allie, that's a huge thing. How are you going to prepare me for this job? I know I'm a hygienist. I know I went to college, but I don't know your equipment. What's that going to look like for me on my first day of work? So exactly. I was always worried about that. I did get thrown into the fire, and it wasn't pretty. Maybe your motivating factors are health benefits. Maybe you are the breadwinner in your family. Maybe that's important to you. So my point here is know what your motivating factors are. And then what is the doctor's expectations of you? So it's okay to say, how many patients are you expecting me to see in a day? What if they tell you 20? What if they say, well, it's a really slow office. Right now, we're only seeing, 2 patients a day. Oh, really? So what's going to happen to me the rest of the 6 hours? So these are expectations that you're asking. What are your expectations of me? And what about work days and vacation? Are you needing me to work 5 days, 4 days? Are you looking at part-time, full-time? Vacation, here's the thing that I was stunned to find out, but when I got into the workforce as a hygienist, that, I had to take vacation when my doctor took vacation. Him and his family would go, every single one of them. Well, not now here at Aspen, but or at Clear Choice. At Clear Choice, I did have to. At my last job at Renew, when I was a director of sales and training, I got to take vacation on my own, but other than that, like most of my jobs, I had to go when the doctor had to go. So if you're planning on vacation or getting married, or, you know, you have an aunt's wedding or your sister's wedding or whatever, you know, that's a question to ask. Am I able to take vacation when I choose, or do I have to take vacation when you choose? What are you looking at me as far as growth in your office in 30, 60, 90 days? Because they're looking at your proficiency. Has Paige picked up the pace? You know, is Paige able to see a patient now every hour? You know, what are they looking for? What are their expectations from you? And then, you know, you're just getting out of school. And I think I might have talked to you about at the paint and sip party, but like, you know, it takes 3-4 hours right now, right, to do an SRP or, you know, whatever. Like, are they going to be a little lenient on you as far as when you get out of school to stretch your appointments? Are you going to have to sit down right now and do a X-ray probing in an hour, you know, for a pro fee? And am I going to have to do this SRP in an hour and a half? Are you guys going to let me stretch? And for how long? Maybe they'll tell you, oh yeah, no worries. You can stretch out your appointments. But then the second day they're going, okay, like, are you ready to start doing SRPs? So make sure you're specific with your expectations. I know, like for us, you know, we definitely let our hygienists stretch out their times as long as they need, whether if it's a month or 2 months. I mean, you know, eventually you guys will get faster and you'll be able to start doing those profies in an hour. But, you know, so that's important. Selling products, you know, is our quota. I've been asked that many times, you know, for Aspen. I hear Aspen has quotas, you know, or we have to sell so many products, we have to see so many patients. You know, we don't require any of that, but I like that they asked that, because I'd ask that. And what about, are you going to pay me if I'm sick? In almost all of the, you know, the practices I worked for, and maybe it's changed this day and age, but like when I was sick, I didn't get paid for it. And I didn't get paid for any, you know, paid time off at all. So maybe, you know, that employer could offer you 3 days, you know, that, or you can bargain with that. Think about bargaining too, negotiations. How would you like to see me best impact your patient base? So we've kind of already gone through some questions, but you guys write these down, or at least think about these. Are you going to pay for my CEs? What does CEs look like for me? I had it one doctor in private practice and he'd split it with me. But you're going to need them to keep your license. So work-life balance, what does that look like? You know, what if my kid's sick, or what if I need to do this? Are you flexible? Are you going to work me to death? I'm going to be your grunt worker. And then this is a question I never thought about asking when I got out of school. And then I found myself, you know, where my 1 o'clock would fall off or my 5 o'clock would fall off. And the doctor was like, take a 2-hour lunch, or go home, go ahead and go home now. It's 4 o'clock. And, you know, like I'm needing to pay off my student loans. I'm needing to pay my house payment. You know, like what am I doing on my downtime? Are you going to pay me? So ask that. What does your new patient flow look like? Does anybody have an idea what a flow of an office looks like? Right? And it's funny because I think about back when I was in school, you know, I didn't know, but like I totally know now. And I've seen lots of different variances of what a patient flow looks like. So it's nice to ask that. Like I told you earlier, that one doctor had me doing the new patient exams. I was taking FMX, I was doing full mouth probing. And then if it was prophy, I could see him that right now, or, you know, if I had time in my schedule, it was SRP. The doctor would come in. So I was doing all that work and I had an hour and a half to do it. I didn't know that that was different, but that way he didn't have to do it all. And then, you know, now like our flow is different too for new patients. All the dental assistants see our new patients. The hygienist comes in and probes. So you get to have that conversation and build that trust. And then the doctor comes in. So ours is different than like private practice. Who knows what how the doctor wants it. Maybe the doctor wants to see the new patients with his dental assistant and then ship them over to you. And the reason I say ship them is because sometimes, you know, like the doctor probes, and with the dental assistant, it's a prophy. They're in my chair, and now all of a sudden I'm doing some probing, and I'm like, well, this isn't a prophy. Like they're bleeding. I'm seeing some 4s and 5s. And now I got to go talk to the doctor. Hey, doc, seeing this. A lot of times doctors don't like you questioning them. Sometimes they're okay with it. Sometimes they're not. And then now if he does agree, now you got to go to the patient and explain why treatment's changed. So anyway, what does your flow look like? And who will be probing, that kind of thing. What type of technology is in your office? Are you going to be dipping film into solution? Do you have a digital workforce? Or what about instruments? I met a hygienist the other day I was in Nebraska at one of the hygiene association meetings, and she was complaining that her doctor will not buy her new instruments. She's had the same instruments for years. She has to sharpen them constantly, and they're pretty much like, her hand's gonna give out on her. She's been there for a while with this guy too. And I was like, why won't he buy you instruments? It's ridiculous. So that's a great question. What happens when my instruments give out? Are you okay buying me new instruments every so-and-so? Talked about the vacations. I went into one office one time and I saw their infection control, and I walked out. I saw what was going on in the back room with the assistants, and I was temping that day. And because I like to temp, I like to see what the office is like. And I was like, ooh, no. These guys don't have good infection control. So these are some questions. Did that help with you guys knowing some of the questions to ask?
Yeah, I have a question about the temping. So when you want to do that, like, can you just do that anywhere? Like, how do you go about that process?
Well, yeah, it depends on the office, there are temp agencies, but like for I'll just say for like our company, we would let hygienists do that for us. Because like maybe we need you in an office, and then you can see, like maybe we're getting busier in that office. So we let hygienists temp, we let hygienists shadow, but some private practices, they won't really let you temp unless maybe the doctor. Like I know this doctor that I used to work for, and he'll let me come temp for him when he needs help, to keep my my skill sets up and things like that. So it's tricky, but there are temp agencies. But with one temp agency that I work for here, or have worked for in the past, you have to have your own insurance. And so that costs like $400 a year. But then you can go temp, and then she does not take out my taxes. So I have to do my own taxes. The other temp agency does, but they pay me a lot less. Like they won't pay you, not near, because they charge the offices a fee to find them a temp hygienist. So they have to pay those temp agencies a chunk of change. So then they're not going to pay you what you're worth. So if you could find an office that'll let you temp just to see, like, hey, I'd love to shadow, or maybe can I just temp here a couple weeks, see what this looks like, So yeah, so that's a good question.
Before you temp, do you have like an interview with them and all that?
Mm-hmm.
Too? Yeah, it says that.
Yep, you would do an interview, and if they offered you the position, like they said, what, Paige, we really like you, we want to offer you whatever an hour, and you agree to that, and you're like, hey, what, would you be willing to let me work here on, on a maybe a 30-day trial? I really want to see what your office looks like. All they can say is no. Right? There's a lot of positions open right now for hygienists. I feel like that, we definitely, have no problem with that, because it's nice for you to see what the office looks like. Or maybe you go shadow and you're like, oh my God, one day is enough. You're like, I love this office. I love this doctor. I love their flow. I love everything. Yes, I want this job. But I was stupid when I got out of school. I just, took a job, I started temping after a while. I'm like, I'm not doing that anymore. So, okay. Those are some questions you guys can ask. How do you end the interview? So it's okay. And I've been stumped before by people who ask me these questions. So they'd ask me, so why do you like working at Aspen? Or why do you like working for, Clear Choice or whatever? It's a nice question to ask, because wouldn't you want to know why I work there? Am I happy there? What's my experience been like? So that's a good question to ask at the end of your interview. And they'll say, do you have any questions for me? Yeah, I do. I absolutely have some questions for you. How do you think our interview went? I was asked that one time and I was like, it wasn't that great of an interview, right? So I had to give feedback, right there on the spot on how that interview went. I really like you, but here were some of the things I would have liked to have heard you say more of, that you had experience here or whatever. What do you think I need? How could I have been a better candidate for you? So how many people I've been asked this before, how many people have you interviewed so far? And I was like, I don't know, like maybe 10. Okay. So am I in your top 3? Like I've been asked all of these questions before. Is there a candidate you like better than me? If so, why? Why did you like him better? You're putting them on the spot, but we got to answer the question. And now you're going to know, what did I do wrong at this interview? So at least at my next interview, I could do better. And then how to close an offer if one is made to you. So, okay, Allie, we love you. We want to hire you. They called you on the phone. So you have not asked how much money they're paying yet, right? You're just going through the interview. And then they call you and say, yes, I'd like to offer you the position. Now we're going to start talking about money, right? So you weren't that person that's like, how much money are you going to pay me? It's okay to ask about healthcare benefits, all that, but like that money thing it's just, you can really set people off when you ask that. So, because they think that's all you're interested in. So now that they've offered you the position, that's fantastic. I love the office. Can I get into a few more details with you? So the hours will be, maybe you confirm, right? The hours are going to be 8 to 5, Monday through Friday, whatever. And then how much were you planning on paying me? Is this an hourly wage? Is this, this is a way to ask without asking. So are you going to be paying me an hourly wage, or is this, why am I losing track of, not hourly, but I can't think what I get paid. So you can ask it like that. And then what is your hourly wage? What did you want to offer me? And then let's say they're saying less than you were wanting, or less than you've had at a different interview. You can always say, you know what, that's a very nice offer. I have a few more interviews, and I have interviewed at a couple other jobs, and I was offered more than that. So I really need to think about that. And then they're like, I've literally on the spot said, you know what, how much did they offer you? Because if I really like you and I want you because I think you're amazing, then, I might be like, okay, well, you know what, I'll match them. And maybe you really did like my office better. And so then now I just closed the deal with you and you closed the deal with me. Does that make sense to everybody?
I have a question.
Okay.
Is it like rude to not accept the job like right away? Or can you like say, I need some time?
I always say I need some time.
Okay.
When I was a manager at Clear Choice Dental Implant Centers, I was a hygienist. It was my first non-clinical hygiene role. And that guy hounded me for 2 weeks. He was the CEO of the company. And I was so happy at my dental office. I love my dentist. I love my team. It was amazing. I worked there a couple of years and I was planning on staying there. And he just would not, he's constantly offering me the job, and he kept raising the amount of money he was going to pay me. And I just kept, the first day I left, he tried to hire me right there on the spot. And I was like, I just need some time to think about it. And he was like, what do you need to think about? He was high pressure on me, and I was like, well, I have a lot to think about. I got to talk to my husband, all these things. So it's fine to say that. It's fine to say that. Go home, talk to your spouse about it, or, your partner or whoever, your mom, dad, whatever. Bounce it off your friends. What do you think about this? And then write down your pros and cons. What did I like? What did I not like? So perfectly fine to ask that. Always send a thank you email, at least at minimum, thank you note in the mail, something. Just, hey, thanks so much for the interview, especially if you want that job. If it's a job you really didn't care about, I guess you don't have to, but like if you want that job, if I don't get an email from the person I just interviewed, especially like in my positions that I've had, I'm hiring higher level positions. I'm hoping to see people say, hey, it was nice to meet you, nice talking with you. I hope you consider me for the position. Something simple. It doesn't have to be a book. Any questions on ending an interview? Okay, these are my doggies. Chico, Charlie, and Cole Pucker. They're my humans, my fur humans. All right, anybody have any question, thoughts? Did this help you guys at all today?
Yes, thank you.
Okay.
I had a question. So in high school, like I worked at Chick-fil-A, but
What's
then
that?
like I worked at Chick-fil-A in high school,
Mhm.
but then so now all throughout college, I've just been like cleaning houses, detailing cars, or mowing lawns. So it's not really like, full on job, but it's still like a lot of work. So how would I put that in a resume? Because I have been working, but not.
Okay.
actually.
So like, are these just odd jobs? Are you getting a paycheck? Is it from a company or just like for friends or?
Mhm. Friends.
Okay,
Or
well,
family.
then, what's that?
Friends or family, yeah.
Okay. I would definitely talk to Chick-fil-A, talk to it when they ask you. And I would say just what you said to me. I worked for Chick-fil-A, tell them about your good things there. In the last year with school, I've been very busy. So I've been doing odd jobs for friends and family. Here's what I've been doing. And then talk to, I was always on time. I was very detail oriented when I was cleaning houses. I always got great feedback from the people who own the house on what a great job I did. I'm a loyal employee, so you can still talk those odd jobs up.
Mhm.
So you can, they don't have to do with hygiene, but that's okay. You just went to school to be a hygienist. So you know what you're going to be doing. Now they're probably wanting to know, I know for me, I want to know, is this person going to show up on time? Is this person going to be good with patients? So, any interaction that you had with people, Paige, at any of those jobs, like cleaning houses, you probably didn't have to deal, well, maybe you had to deal with the owner of the house, right?
Mhm.
So maybe you could talk to that. I had great rapport building with the owner of the house. She really loved me. She trusted me. So right there, okay, I'm hearing what you're going to do to the patients. You're going to build that trust with the patients. So turn that into something that will work for you in the interview.
Okay.
That makes sense?
Yeah, thank you.
You got it. Anything else?
I had
Okay.
a question, like kind of like regarding the whole like asking about like how much you're gonna pay someone. So like, okay, my thing is like I don't know, I don't want to even go for an interview for a company that like underpays their workers. So like how do you go about that? Because I don't want to set up an interview and waste like my time and the other person's time if like the job is only going to pay me like $15 an hour. So like how do I, like, yes, I do believe like, we need to have the same beliefs and everything, but how do I go like about that?
Sometimes, when you're applying for the job, they'll have a pay range, so you can know what that pay range is before you even apply for those jobs. I'm trying to think because I don't know too many people that will tell you what the pay is. Even like when I've been in private practices, the doctors wouldn't talk to me about that right from the beginning. I mean, if I'm just trying to think, like Sam, like let's say how are you planning on applying for those jobs? Like online? So then they're going to send you or call you and say, hey, we'd like to interview with you. So if I called, let's say I'm the person that's calling, hey, Sam, we got your resume. We'd like to interview you today. What's a good time for you? And then you said, yeah, we could do this time, but I was just curious on what is your pay? It's a tricky situation. You might have to interview and then, you waste some time because somebody might be like, okay, fine with it. You might find those people who are, but more than likely people don't really talk a lot about an hourly rate. I would make sure that I went online and found out what is your pay scale. Or if you know anybody else who's worked for that company before, ask them, what do they pay? You know, like do some investigating on your own. I know that's what I always do. Like before I go work, even when I went and worked for the other company that I worked for right before Aspen. And even with Aspen, I was like, what is that range? I got online, found that job that, you know, that was online, and what was the pay range? It was like from this to this. Well, I wanted to be here, you know, but as long as I know I can be here, you sound a lot like me, Sam. I mean, and I know it's so funny because we're all so different. Someone else today is like, I don't care what I get paid. I want, you know, to have that. So it doesn't mean that we're bad people because we want to be paid what we're worth. Because we're still going to give that amazing patient care. I know I'm super, super passionate about good patient care. Like I will not do what's wrong for the patient, but I want to be paid because I'm good at what I do, you know? So I think, you know, it's going to be pretty tricky for you to ask that question. I guess you could try it a few times and just see like, hey, you know, before I interviewed, I just wanted to make sure that you were in my pay range. I was looking for, what are you looking for? 40, 38? I don't know. What are they paying in Indiana?
I think that isn't the average pay like 35 an hour?
In
Or
Indiana?
Yeah, I was gonna say, I think it's like
Well, then-
35. I think you're right.
35. Okay, then you can ask that like, hey, I just want to make sure before I interviewed, are you in the average pay range around $35 of Indiana? Instead of just how much do you pay? You know, like I know the Indiana's average is around 35. Is that which, are you in that same pay range? You
Yeah,
know,
I like that question. That's a good, instead of just saying like, how much are you willing to pay?
Yeah. And you know, in life, there's so many things I could teach you guys in life as far as, but everything, the one great tip I'll give you is always turn that into a question on people. And, you know, and make sure that you phrase it right. You can always think of a different way to ask a difficult question by turning it into a question on them, like what we just did. So that's really, really a famous thing that you will be successful in life if you do that. Okay, anything else? All right, Paige, I will send you this recording for anybody who wants to see that didn't make it today. You guys, you know, I've talked to a couple of people, I don't know if you're on right now, but like that want me to look over their resume, and that's fine too. If you have any more questions or whatever, or you go to an interview and you got stumped, you can email me and I could try to help you out on how you could have answered that, or you know, or if you have one coming up and you're nervous and you want to go one-on-one, just give me a call or email me.
Thank you so much for your time. We really appreciate it. And this was super helpful for us. So.
Good. Absolutely. No problem, Paige. I'm glad to help you guys, and be seeing you maybe sometime in May.
Thank you.
Thank you.
Bye, guys.
Bye.
Have a good day.
You too.